All right. Hello, everyone. Good afternoon. My name is Alexa Carey, and I'm the Partner Relations Coordinator supporting both the South and the West RPUs at CareCompass Network. I'd like to welcome everyone to today's Lunch and Learn. Before we get started with the presentation, I'd just like to go over a few housekeeping items. Today, the presentation will be recorded for quality and assurance purposes and may be uploaded to the CCN website after. There are going to be two sections to the presentation with two demos. Throughout the presentations, if you have any questions, please feel free to utilize the chat box located at the bottom of the screen. After the presentation, but before the demo, both Emily Pape and Chris Munoz will be fielding those questions. And then after the demonstration or throughout the demonstration, if you have any questions, please feel free to utilize the chat box or the raise your hand feature. And that was a tongue twister. As always, please feel free to send your questions throughout the presentation, and we'll be collecting them and addressing as many of them as possible. I would now like to introduce our Executive Director, Mark Rapecki, who will then be introducing our presenters. Mark?
Yeah, thanks, Alexa. And wow, it's so good to see everybody. It's a good turnout for a Friday afternoon. I guess we're taking advantage of the cold onslaught of late winter and joining in by Zoom here. But we have a lot of good content for you today and a lot to catch up on. So this is, I think, a good overview. And in some cases, what some people have done is had follow-up requests to maybe have some one-on-one questions. So there could be more that comes out of this, but we wanted to take a moment to explain an overview to the partners what's available. I think that there's been a lot of resources that we've made available over the past 5 years, some of it more recent. And so this is an example of that. But there's some really powerful tools that are out there that we've spent a lot of time building, perfecting, and even some of you I see have been in some of our recent RPU meetings and have been giving us feedback at how we could modify these things. But these are some solutions that are available to partners and can have access to them today. So we really wanted to have a chance to overview that to you, and that's really going to be the key focus of our meeting here today. This is, I think, addressing also the big question when we talk about CareCompass Network. We're working with partners and we have quote unquote data systems. It's a challenging question of understanding what does that really mean. So today's overview is really meant to help you understand when we say CCN has different data systems, what does that mean, and what does that maybe provide and offer to your particular organization. So we have some really well qualified people. I won't go into their backgrounds too much; it would take too long. But Emily Pape and Chris Munoz are really, really skilled in these different systems, and they do get very highly technical. So as we go through and we have moments for Q&A, as much as we have questions on what are the systems physically able to do, there's also, can you define that term or explain what you mean by that? We'd love to engage with you that way. So anyway, I'll hand off to Dr. Pape, and she can begin the Lunch and Learn series. Emily.
First task is unmute myself. All right, even after a year, I still make fumbles with that. All right, so as Mark said, we would like to introduce our Community Health Data Center today, and as well as give you an update on our SDOH Infrastructure Explorer. So we'll be going through both of these tools. Chris is going to give a demo in a few minutes. But I wanted just to first start out reminding people about the Spectrumetics Population Health Management Platform and the various tools that we have available. We bring several different kinds of data into that platform. It's a population health management platform that the main purpose is to kind of churn through different kinds of data and then process the data and display the data in a way that can help inform decision making. So along those lines, we have a couple different tools that are available. So on this slide, you'll see the e-measures dashboard and the gaps in care dashboard. These dashboards, we've been using, CCN uses them, and we're able to provide access to data partners that send us data directly. So we have different kinds of data coming to CCN, and the data or the organizations that are sending us billing data have access to the e-measures dashboard and the gaps in care dashboard. These dashboards reflect many of the performance metrics that we used in the Disrupt program. And these tools are really geared to help organizations identify where they have essentially gaps in care that's provided. So they're meant to track performance over time and then provide some insight into how partners can engage patients and close some of those care gaps. So I won't go into further detail about that, but if that's something that your organization is interested in, we can have a separate conversation. Where I want to focus today is the Community Health Data Center and our SDOH module. These tools are tools that are open to any of our CCN partners. They utilize public data and offer some different navigation tools. So there's no PHI. We're really using data that any organization could pull down from the various sources and use themselves. But the idea in these tools is that we're kind of making that work easier for you. And you'll see how we do that. But the idea is to bring, to aggregate data from various sources and then process and turn it around and make it just more accessible than it would be if you were going to many different sources. And then we also have the ability to create custom dashboards. So I left this in here because it's also kind of a conversation starter of how CCN can support partners for your various management needs. So if you have a need to be tracking different kinds of activities, then I would encourage you to reach out to us through your RPU leads and partner support specialists, and we can try to go down a discovery with you of how CCN can support you. All right, so turning now to the Community Health Data Center. Last year around this time, we convened a couple different focus groups with partners, specifically thinking about how we can better support partners with grant services. We have a grants manager on staff. And really over the last year, we've really thought about services that we can provide our partners that can either support our partners to go after more advanced grants or grants that they didn't feel like they were necessarily ready to go after, or larger grants. So we spent the time thinking about and working with partners, listening to what their needs are. And based on that information, one of the ideas that kind of percolated up to those groups is that partners would really benefit from a resource that helps them enhance their needs assessments as they design programs and then look for grants to support those programs. So that's really the goal of the Community Health Data Center. It's really to bring in a range of data resources that makes it easy to access and easy to use, that allows partners to do some of that data discovery on their own. So we have two main features here. One is an external link to a lot of different data sources that already have pretty easy navigation tools themselves. We don't want to recreate the wheel. And then for data sources or data sets that don't have those navigation tools available, to create the tools themselves. And so you'll see both of those examples in this demo today. The idea, of course, is to create kind of a one-stop shop and make it cut down on the kind of data search time, and then make it easier to find the results that you're looking for, to better assess the need for your program, and perhaps identify new needs. So one of the just kind of example use cases that we think that this tool can help with would be, we have a CCN partner who is applying for a federal grant related to opioid use disorder services, and specifically thinking about Cortland County. I didn't want to name any partners, but this came up over the last couple of months, and we were kind of already in the development of the Community Health Data Center at that point. But so we kind of did the legwork for the partner. But what we did, when they came to us, they said, well, we're trying to figure out what this current scale of the opioid use disorder epidemic is in Cortland County. And we want to know about some other measures of substance use disorder, again, for that county. answering those questions helps the organization be able to demonstrate the need for the particular program that they were applying for. And so we set out to be able to provide a resource that can apply in this need, and then also where CCN is doing it directly or where the partners are accessing on their own. Okay. So we're going to turn now to our first polling question, getting at this general question. And I'll let Melissa, do you want me to, yep, here it comes. So our first polling question is, what kind of data do you most often use in a grant application? And you guys can multiple choice, so try to choose the option that best fits your needs. You can click that submit button down there. And are we going to see the results come up? Okay. Great. Oh, great. Okay. So lots of use across the different kinds. So healthcare data, demographic data, and social determinants of health data. That's great. And really what we aim to do with this tool is hit all of these three different kinds of data. All right. So the team here really searched, across all 9 of our most recent county community health needs assessments that were done over the last year. I think that was in 2020. And one thing that was pretty obvious from the very start is that each of the counties really took a different strategy when completing their health community health needs assessments. And one obvious desire for the system is that we are consistent with our data resources that we're covering across the 9 counties. So when we looked for data to include, we wanted to include information that was commonly used in the community health needs assessments. So we hit on health status, different aspects of healthcare utilization, demographic profiles and economic indicators, and social determinants of health. Now, I don't know if you've read the community health needs assessments, but Broome County's assessment was about 800 pages. And I think it was Steuben County's was about 50 pages. So a lot of variation across them. What we're trying to do with this tool is really perhaps even broaden those health assessments. And so, if you're in Steuben County and you're using the county health needs assessment for local resources, it would be pretty limited compared to what Broome County put together. So using the Community Health Data Center, you would basically instantly get access to a lot broader data sources. In terms of tools and functionality, what we really wanted to do is just make it as easy as possible for organizations to navigate and then to be able to export their results that they've found. So we have links to external data sets that we deem to be user-friendly. And then we created the navigation tools for a range of additional data sources. We looked mostly in Open Data New York for the data sources. And then using that, we created different forms of charts, trend graphs, maps, and then some data tables that you can export. And then you're able to filter by county or region, time, and then your specific variables that you're looking at or indicators. So, going off of that original need that we identified, the target users for this system are really the grant writers among our partners, and then program directors and managers, even executives. One of the some of the feedback that we've gotten already is that this kind of tool is useful to support strategic planning as organizations identify, where their programs are going to go in the future. So that's, could be for a particular program or it could be for an organization. We also want to make the tool available to our county health departments. Again, to assist in that next round of community health assessment. Same goes for our healthcare organizations. All right, so let's turn now to polling question number 2. So how much time does it usually take you to spend, or that do you usually spend looking for different stats for grant applications? Less than an hour and then on up. Okay, as people complete that. All right. So it looks like, again, there are very few people who are spending less than an hour here. So what we hope that using this tool, we can shorten the time that you spend searching for data. You know, the tool itself is, we can add to it over time. So if you have suggestions for additional data sources, we're happy to hear them. We'll probably go through a process of adding new ones, maybe twice a year. We can do it more frequently than that. There's just always costs involved. So we'll kind of see what the demand is and what the needs are. All right. So I did want to just pull out some examples of what we have in there, you know, kind of going back to that example need from our partner that wanted to look at opioid use in Cortland County. I navigated to the New York State Opioid Dashboard and just found some stats on overdose deaths from actually any drug in Cortland County. And you can see here we have a nice little graphic from the dashboard. Cortland County has a much higher rate than New York State in general. There's also a measure of opioid burden, and they define that as the number of ED visits and hospital discharges related to overdose, abuse, dependence, or unspecified use, and then opioid overdose deaths as well. And that's expressed as a rate per 100,000 members of the population. Again, Cortland County, in this case, it's a little bit lower than the state average, but no significant change over the last couple of years for that. We also found that engagement in chemical dependence treatment programs has decreased over time. And here I'm really just, using the opioid dashboard from the state and pulling out graphics. But there's quite a bit of data on this actually from the state. So, linking through our system to the dashboard is a great way to find data, especially if you didn't know that there was a dashboard out there. And then I also navigated to data from the behavioral risk factor surveillance system using our navigation tools to find just one measure here I pulled out on binge drinking in Cortland County. Using our system, you can compare the county rate to the region, which is Central New York, and then to the state average. So just examples of how we met that need that arose from the partner for their application for an opioid use grant program. Okay, so I'm going to turn it over now to Chris, who is going to launch the system and show us how to use it.
Everybody, thanks, Emily. Okay, so I'm going to briefly go through the two modules you mentioned in the PowerPoint presentation. Okay, so when you first log into the Special Medics tool, depending on your access, you might have access to multiple modules, but for this demonstration, we'll be going over the SDOH module and the Community Health Data Center. So one rule to keep in mind, if you log in here and it's hard to see things, if you just hold the control button down on your keyboard and use your mouse scroll wheel, you can use the browser function to increase the view of your screen. So again, if you're having trouble seeing certain menus, that's a good way to zoom in and get a better view of what you're looking at. Okay, so I'm going to dive into Community Health Data Center. Okay, so this is a tool that was mentioned that, again, we're using external data links and public data sources to populate these dashboards. And again, just take a lot of the work of having to go to Google, find these resources, explore them, download the information to really make sense of them. I mean, a lot of that work has been taken out and it's put into the dashboard here. So first I'll go through the community health portal, which is the external link portion. Okay, so these are the current listings we have in external links. So on the left-hand side is your demographic information about the 9 counties we serve. And on the right-hand side are the various public other links that link to the opioid dashboard. There's cancer dashboards, food insecurity, just various areas of information. So I'll click on, so first I'll just dive into, so again, if you're looking for demographic information, a particular county or city, you will want to utilize these links here. So if we click on the Broome County link, it's going to take us to the dedicated census page for Broome County, where again, we can get a quick view of the population, median household income, poverty rate, and education rate. And then if you look on the left-hand side, there's various other categories you can look at within Broome County. So you can click on health. You can see the insured population, business and economy, education, employment, so basically all the areas of the SDOH spectrum. So again, if you're looking for more specified information, let's just say you need something beyond Broome County, you can actually use the search bar up here, and now we can type in Binghamton and look at the same stats, but for the Binghamton area. So again, looking to get a quick view at our population, our income, our poverty rate, and things of that nature. And again, all items here, you can take a screenshot to plug into your spreadsheet. You can export the information from the census site using the export button here. So it'll give you a link if you want to just get the direct link to the item, or if you actually want to export it, you can, again, you utilize the link here to get access to that. Okay, so I'll pause for any initial questions. I'll just pause here before I go any further. No? Okay. All right, so that is a demographic section of the 9 counties. And again, as you use those tools, you can drill down further into cities, zip codes, whatever you need. Okay, so now turning attention to the right-hand side. So again, we can dive right back into the opioid dashboard. So again, a lot of these dashboards are managed by New York State. And again, some people might not know that they exist. So if you just utilizing our tool, you can really discover some dashboards you might not have known existed out there. So now we're going to look at the New York State Opioid Dashboard. So again, so initial view, it gives a view of the state. So again, you have your keys here, so you can tell what the indicators are. And besides just the opioid indicator information, there's also things on prescription monitoring. Gives you some breakdowns on those if there's data available. Overdose death, Mercy Department. So various information on the opioid demographic. And then if you need information by county, you can just switch it over to the county dashboard. And using the drop down here, you can switch counties, and the tables below will update to reflect that. So we'll just click on Broome. Hit apply, and then again, you can quickly get access to these indicators by the county that you're searching for. And again, this also will allow you to download the table data. If you're interested in that, you can go right into the raw data of the table and download that. Maybe there's something that you're interested in, but you really don't know how to transform it. You can always contact us. We can definitely help you with that. If there's a view you're trying to establish that's not already pre-established in the dashboard itself. Okay, and then just to expand further on the census data, which is maintained within the American Community Survey, that also is out here. So again, if you're looking for some additional information on particular areas, you can quickly utilize this tool as well and get information on social characteristics, economic, housing, and demographics. So by clicking on one of those, we can bring up this. And again, so it gives you access to more information, but unfortunately, this information is kind of displayed in a rows and columns format. So again, if you see something out here you really need, but you want to put like a graphical face on it, you can contact us. We can build. That's where that custom dashboard piece comes into play. So if there's something out here you would like to see in a custom dashboard, you can just let us know. We can definitely accommodate that. Okay, so in hindsight, that's the community health portal. Again, I'll pause for questions before we get on to the next module. If anyone has any questions or comments.
I have a quick question, Chris.
Yes.
How often is the data updated?
So what you just saw from the community health portal, I mean, these are all public data sources. So it does vary between when they're going to be updated or not. So for example, like the community survey data right now is up to 2019, for example, because it's based on various surveys and the census information. So again, all these data sources, they kind of have their own timetable since they are managed outside of CCN. So they can be anywhere from 1 year old to about 4, depending on the data set and who manages it. I think we just had a question come through.
Yeah, I can read it. Oh, it's to everyone, but that's okay. When will the newest census data be available and incorporated into CCN Data Center?
As far as the new census data, I haven't seen time frame on that, so I'll have to go back and take a look at their release schedule. I don't think it's currently available, but once it is, we can definitely have that incorporated, and it shouldn't take more than maybe 2 to 3 weeks to have that implemented in here. So yeah. Okay, any other questions? No? Okay, all right, so now we're going to dive into some of the public sector data. Okay, so this example here, this is the BARFIS information, so the Behavioral Risk Factor Surveillance Survey. So again, normally when you see this data out on the web page, if you would go get it yourself, again, it's housed in this type of format, just rows and columns, really doesn't speak to anybody. Information you're looking for might not instantly pop out at you. So again, utilizing our platform, we've really put a face in this information and use geographic tools, charts and maps, and easy to use filters. So that way, if there's a particular thing you're looking for, you can easily get to it. So you can look down here. So for example, if we're looking at a particular domain of, let's see, promote a healthy and safe environment. Not that one. Okay, so, all right, so sorry, preset. So we're looking at improved health status and reduce health disparities. And the health indicator we're looking at is disability. So again, right now it's preset to Albany. So if you wanted to look at what the rate was in Broome County, you can click there so you can see your county rate, region rate, and the state average. So then you can really do a comparison of your particular county or area against the state average and the region average. And then utilize your download tools up here. You have various formats you can actually download this information. So if you want the images already preset, you can download that. If you want it in a CSV file, you use data, Excel file, crosstab, PDF, and you can even download a pre-populated PowerPoint presentation of what you're seeing on screen. Also too, when you get to one of these dashboards, you're not exactly sure what you're looking at, you can always utilize the information tabs up here, or if you hover over it, zoom in, make it a little easier to see. It gives you a pretty detailed description of what the information is. And also the link to the actual website is here also. So utilizing this little tab here, you can get to the exact information, where the data is coming from. If you're curious, if you want some more information. So again, you have access to all that as well. But again, as I had mentioned, the data in these websites is usually stored again in columns and formats. So you would have to go through the process of filtering it, downloading it, transforming it to really get the view that you're looking for. But the tool kind of takes all that work away, because again, it's all pre-populated for you, and you really just have to you just utilize the filters to get to what you want to see. Okay, so I'll pause there again for questions, comments.
Chris, do you want to show them the vital statistics? I think it's one of the last tabs there.
1 second. Yep, here it is.
Great.
Okay, so again, here are the vital statistics desk by resident county, region, and selected. So again, when we get in here, we can hover over our information icon, get some quick terminology. Again, access to the website where the data is stored is here as well. So again, here, so again, we have our filters here. So if we're interested in a particular county, looking for a particular cause of death, you can quickly use the filters and get a breakdown of all that information. And then down here is your graphical view. So again, I have the cause of death on disease of the heart. So, and this current data set goes to 2018. So as I had mentioned, particular data sets, they kind of have their own timetable of when they're updated. A good way to find that out too, if you go to the actual website where the information is stored, you can usually see when particular items were last updated. So it looks like this one was updated March 2nd, 2021. But the metadata is still cut off at that particular 2018 portion. So and again, you have access to the raw data as well. Okay, so that's a high overview of the Community Health Data Center.
Yeah. I was just going to open it up to see if anyone was interested in looking at other specific sources or types of data.
Question, what is Alice? So we can open that one up. So this is here. So again, the issues has to do on employment. So we can open up that data source for you.
Yes. So Alice is one of the national assessments of poverty, really. And I know the United Way organizations use the Alice indicators to direct some of their programs. But in general, it's just a really good resource on looking at different aspects of, being asset limited, income constrained, but employed. So you can use this tool to get to county profiles. Again, this is one of the sites that has pretty good navigational tools, and you can get to these graphs and charts pretty easily. And then I believe you can export them as well.
Yep, so that is the Alice information. So we just had another request to look at the prevention agenda. So I'll pull that up. Okay, so here's the prevention agenda. So this really looks at premature death statistics, hospitalizations, chronic diseases.
There's also navigational tools for the prevention agenda on the, one of those, the thumbnails that you can show too.
Yes, I can show back into. Yeah, we do have a dedicated dashboard set up to the prevention agenda data as well. So again, depending what your indicator of interest is, you can't select it here. Zoom in a little bit. It's probably hard to read some of these. And again, if you're interested in a particular county that these apply to, you can always go to the county tab, select your county of interest. And then get a comparison of the county, the state, and even looking at the prevention you had to put in for the 2024 goal by New York State.
All right, so any final questions on this tool? If not, we'll introduce the other tool. Okay. All right, so I'm going to take back control and kind of go back to our slides. Okay, and here we go. All right, so we overviewed the Community Health Data Center. We're going to turn now to our SDOH module. So there are two tools within our SDOH module. The first is what we call the Infrastructure Explorer. And this is a tool that is meant to assist with connecting clients to needed resources. It's really a community resource directory that's enabled with maps and filtering. So what we do is display organizations in our area that provide a variety of different SDOH services. It's organized by the type of service or the type of facility and organized by geography. And then the other component of the SDOH module is what we call the Sdoh Dashboard. This is a dashboard that kind of similar to the Community Health Data Center, uses public use data to identify areas, census tracts, or zip codes that are to compare them to the New York State average in terms of 5 general fields of social determinants. So we'll show you what that looks like. Especially related to the Infrastructure Explorer, a primary use case of using the system is really to have a tool that provides quick access to a variety of different resources across our 9 counties. We created this tool as a way to support referrals to to those services, and of course we're including services and organizations that go beyond our partners. So the target users of the Infrastructure Explorer are really frontline staff, including social workers, navigators, community health workers, and care coordinators. And then using the Sdoh Dashboard, the usage of that tool may be more related to program managers and directors and executives, with a similar use of using that data and results to do needs assessments and identifying program areas in the community. All right, so we'll turn now to our polling question number 3. How much time does your organization spend looking for area service providers to provide services to your clients? Just a quick poll question there. All right, so again, kind of across the board, some organizations it's not an incredible amount of time, and other ones are spending more time at all in general. All right, so the purpose again of the tool is really to have a broad sweep of area resources that are available for services, and to be able to kind of identify, again, using public data sources, what the services are. So this is just a snapshot of vocational services that are provided for a disabled population. Chris will show the tool again, but for these two types of services, the facility groups, these are the results that we get, a smattering of organizations across our 9 counties. And then further information is available for each of these. All right, so we'll turn it back over to Chris to do a demo of the tool.
Okay, so now we're going to dive into the SDOH module. So we'll show the Infrastructure Explorer first. Okay, so Infrastructure Explorer tool is basically it's a curated list of HCWest search services throughout the 9 county area. So looking at these top sections here, these are the areas that the facilities represent in services. So you have, again, develop disability services all the way to substance use disorder services. The numbers under each one represent the number of facilities that fit within that category. So down here we have our map of them actually pinpointed over the 9 county region. So using our filter here, let's say, for example, we're looking for, again, we're just going to pick up elder care services. Our map's going to update and show where those are over the 9 county region. So again, it might be a little hard to see here. So we do have the expanded view that you can click on. And this gives you a much broader view of where these facilities are within each county. So then again, then using the tool further, if you want to see who these particular ones are, you can do that. So say we highlight these particular ones here. You can hover over, get a quick view of them. If you want to see the entire listing, click that tool there, open up a new window where you can actually see everyone you have highlighted in that section. So if you want to download this list as a spreadsheet, you can just click download all rows as a text file, and it will download everything you see here into a spreadsheet format for you. Again, you can select multiple facility type groups as well. And again, the map's just going to update as you make your selections. So again, you can highlight all those, get a detailed list, download the list. So again, if you're looking for resources you can refer out to, you can definitely utilize this tool to, again, use the filters for the type of service you're looking for, highlight those services, and then download the list. Okay, so I'll pause there for any questions, comments about this particular tool.
And I'll just note that one of the things that's in development is the creation of a CCN partner profile. Of course, this covers organizations that are not CCN partners, but what we'd like to do is build a profile that reflects the totality of services offered by an organization, and then some directed information for referrals. And there was just a question in the chat about how this information is maintained. We pretty much used, again, data from Open Data New York, yep, for lists of organizations that provide these various resources. So It's not the 211 resource guide directly, but instead a kind of a broader search for these services. So this is something that CCN has to maintain.
Okay, I'm not seeing any other questions come through, so I can explore the next section of the SDOH module. Okay, so in this particular tool here, this tool is utilizing the American Community Survey data by county all the way down to zip code in particular service areas. So I think prime example, if you were a grant writer looking for particular information to fulfill or propose a grant, and you weren't exactly sure some of the problem areas in a particular county or zip code, you could utilize this tool here to get a good view into education levels, income, housing, employment, transportation, with the red line indicating New York State average. So you can really tell if a county or zip code is below or above the state average in these particular categories. So again, we're looking at this particular zip code here in Broome County. Just want to look at Broome County here. We have that highlighted. The county level. So again, as you drill into the map, your values down here will change, indicating if that area is up below or above the New York State average. And if you not fond of clicking on the map, you do have your filters here where you can again have access to the same information to filter down the map and your values being displayed. And like the other tools, again, if you once you get the view to your liking, you can download it as image, data tab, Excel, PDF, or pre-filled PowerPoint. Okay, so I'll pause here for any questions, comments on this section.
And this is also one, this utilizes the American Community Survey. So there is a particular cycle to that data. It's I believe they use the 5-year cycle. So it's updated as that data source is updated. Okay, so the question is food security an SDOH category or subcategory? There are nutrition programs. Oh, so I think you mean about related to this. Can you look at the SDOH? I don't know actually if food is in this one.
Can we go back to the Infrastructure Explorer? Is that what you're referring to?
I was the one who asked the question. Sorry, I was curious if you go back to that screen you were just in with the map and the drop-down menus.
Oh, yeah, no problem. Hold on.
I wasn't sure if there was a food-related option in either the main category or subcategory.
Yeah, initially I'm not seeing a food insecurity option.
Do you know if that's something that might be integrated in the future?
Yeah, it's definitely something we could look into and implement. Yes, so I can take note of that.
Yeah,
thanks. Yeah,
we do actually have SNAP benefits in towards the bottom of the list.
Yeah, did see that.
Yeah, I do a lot of grant writing for produce prescription programs.
Mm-hmm.
And that's a particular area where it's difficult to sort of call that data and mine that data. So if it's something, as you continue to develop this, it would be instrumentally helpful to have more nutrition or food security data at our fingertips. Thanks.
Mm-hmm. Right. Yep,
Okay,
good
thanks for the
suggestion.
feedback. Yeah, definitely look into that resource and see what we can do. Yeah, I just had a question too on the bar graphs on the bottom. Okay, so just to briefly explain them. So the red line indicates the New York State average. So that's where New York State is. The percentage to go, which means you would be at 100%. I mean, basically, no one's ever going to be at 100%. So that would kind of put you like in the 1% category if your particular zip code was in the 100% category of all these items here. So that's what that represents there. So the red is the New York State average. The blue indicates the particular region that were clicked on if they're above or below that average. So again, let me just zoom into Franklin County here. So that way you could say, so looking here, you can tell if Broome County is below or above the New York State average of the red line. And the to-go portion is basically how much more we need to get to 100%. Did I answer your question?
I think so. All right, so we can actually, we will be posting the video to the website, I believe. Melissa can confirm that. We can also, if there aren't other questions on the systems, we can kind of turn attention now to how one requests an account if you are interested in having an account for these tools. Okay, yes, the recording will be up by Wednesday. All right, so I'm going to turn back to my slide here. So we do have an access request form. Actually, Chris, you can probably put this in the chat, the link to the form. We're using a system called Smartsheet 2 as basically just a web form. And you just kind of fill out a short form. If you aren't already a user of Spectrumetics, we do require that you fill out an external user agreement. It is actually one agreement for several different CCN systems. So if you may have already done so, if you have access to our SFTP site or other tools. This form is also on our website under the patient, under our Spectrumetics link under for partners. And so if you aren't able to do it right now, you can navigate to it from our website as well. Just a note, we do, because this system in general, the platform in general does enable us to share PHI level information. We do require two-factor authentication. We use an app called Okta, if you've heard of that. It's very similar to the Duo app that Microsoft maintains, but a different company. It's really just, when you log into the system, you'll just be asked to enable or approve your access on your cell phone. So there's an app you can put on your phone. You can also just use a PIN code for each time. It's very easy to use. And of course, Tim Tracy, who is our IT manager, is a great resource for accessing the tools, as are Chris and myself.